Hi, and welcome everyone. Thanks to all of our registrants and viewers tonight. We are excited to welcome you to our Fireside Chat, Heart Health for Caregivers, in honor of American Heart Health Month. I am Jenny Woodworth, a licensed independent social worker and the Director of Programs for Courage to Caregivers. And I'm super glad to be here with you tonight to talk about this very important topic. So I'm going to do a bit of housekeeping first. We are recording this program, but only our presenters will be recorded. So don't fear about that. Those of you that are watching, you are not going to be on video. We may not have time for live questions, yet if you do have follow-up questions, feel free to add them to the chat, which we'll be monitoring, and they'll be deleted following the broadcast, so they won't be included in the recording either. Or if you want to ask a question anonymously, you may text us at 216-536-7699. Know that we did receive questions submitted prior to this event, and we will include as many as we can. We were not able to include them all in this presentation due to potential time limitations. You will receive follow-up information that will hopefully assist you further. Let me take a minute to tell you a little bit about what Courage to Caregivers does to support family caregivers. Courage to Caregivers is a nonprofit located in Northeast Ohio with a national reach now, and our mission is to provide hope, support, and courage to caregivers and loved ones of those living with mental illness. We focus exclusively on you, the caregiver, and see ourselves in the caregiver burnout prevention business. We offer 3 programs, currently at no cost to the participant. All programs are virtual, and again, we are supporting caregivers nationwide. We have a peer support program that matches caregivers in need with trained volunteers or certified family peer supporters who have experience supporting someone living with mental or chronic illness. This program, again, matches caregivers who have had similar lived experiences so caregivers can know that they're not alone and helps them find resources and an empathetic ear. We also have weekly coaching groups that are co-facilitated by a licensed social worker and a trained peer specialist. Our coaching group model provides essential tools to build a caregiver's resilience. While staffed by professional therapists, we do not provide therapy or counseling in these. These are definitely your coaching sessions based on our curriculum. We also have a breathing meditation program that is also streamed on YouTube, where many of you are seeing us tonight. We have an amazing yoga instructor that incorporates breathing techniques, light yoga movement, guided meditation, and deep rest, typically a yoga nidra. So if these things sound great to you, please follow up. Please reach out to us. We would love to support you. And now I'm going to get to why we're all here tonight. I'd like to introduce our panelists this evening. Thank you. Dr. Irani is an assistant professor at the Francis Payne Bolton School of Nursing at Case Western Reserve University here in Cleveland, Ohio. She received her undergraduate nursing degree from the American University of Beirut in Lebanon and her doctoral degree from the University of Pennsylvania. Her personal experience and clinical experiences as a staff nurse in Lebanon and in the United States have shaped her passion to understand the needs of family caregivers and help them support their health. Dr. Irani leads research projects about psychological and social factors that contribute to the well-being of people with chronic illness and their family caregivers, with a specific focus on cardiovascular health. Her overall goal is to design and implement family-based programs to improve mental health, cardiovascular health outcomes in diverse populations. During her free time, she enjoys spending time with her family and playing with her 3 boys, ages 8, 6, and 8 months. We also have Dr. Edmiston. She is a non-invasive cardiologist and medical director of the Cardiology Telemetry Unit at MetroHealth Medical Center. She cares for patients in both inpatient and outpatient settings, interprets cardiac imaging, and is actively involved in medical education. She holds the title of assistant professor at Case Western Reserve School of Medicine. She developed a passion to advocate for her patients' mental well-being, which she believes is just as important as treating for other risk factors of heart disease. It naturally leads to a healthy mind and body. Dr. Edmiston is excited to bring her medical background and passion for mental wellness to Courage to Caregivers. She joined Courage to Caregivers as a board fellow through the Cleveland Bridge Builders Program. My goodness. Well, welcome to you both. Your biographies are just amazing. And I know you're here for a reason because your heart is with family caregivers, and I really appreciate that. So welcome. And I'd love to start this session with some definitions. Like, what is it we're here to talk about? What is heart health, cardiovascular health, and what is cardiovascular disease? So I'm going to start with you, Dr. Edmiston.
Thank you for having me. This is a lovely idea to get this together. So coronary artery disease, heart disease, atherosclerosis, it essentially describes the same mechanism. So the coronary artery is the pipe that supplies blood to the heart muscle. Over time, cholesterol builds up into that pipe until the cholesterol buildup becomes vulnerable. And a blood clot can form there and completely block that pipe. And that's what having a heart attack is. And you can have that pipe blocked, let's say 70% of the time. So your heart's a muscle just like any other muscle. When you are working hard, when you're exerting yourself, it's beating fast and it wants more blood, it wants more oxygen. But if that pipe is blocked 70%, not enough blood and not enough oxygen can get to the heart muscle. So it can cause chest pain. And the typical heart chest pain, or angina that people say, is pain that occurs when you walk and it stops when you stop. It's exertional. And the big kind of important thing, the reason why this matters is that heart disease is the #1 killer in the world. 12% of adults in the US live with heart disease. And more importantly, it can start developing as young as the age of 2. So this is not really a disease of old people anymore. I've seen patients as young as in their early 30s have heart attacks.
Okay. Thanks for your answer. Dr. Irani, is there anything you'd like to add?
Yes, well, good evening, everybody. Thank you so much for having me today. I guess I'll take a slightly different perspective to this and focus more on heart health or cardiovascular health more broadly, in a way to think about risk factors or things that you can maybe address early on to prevent you from reaching to the stage of having a cardiovascular disease. So when we think about heart health, we're thinking about the various factors that could put you at risk potentially that you could maybe intervene on and prevent, such as knowing your blood pressure, knowing your cholesterol level, knowing what your lifestyle looks like, whether it's your diet, how much active you are, your smoking status, and all of these factors really contribute to your overall heart health. And again, thinking about it from more of a preventative lens for you to avoid getting cardiovascular disease.
Great. Well, thank you both. And I will definitely be getting more into the preventative side of this as the chat goes on. And I wonder, Dr. Irani, like, why do you think this is different for caregivers compared to maybe the average, again, air quotes again tonight, average American when it comes to heart disease? Do you think the potential for cardiovascular disease is higher for caregivers, or say more about that? And then I'll also hear from Dr. Edmiston as well.
Yes, absolutely. So we often think of caregivers as superheroes, but often at the expense of their own health. And it doesn't only stop at your mental health. So I think there are 2 ways in which I see caregivers being more vulnerable to cardiovascular disease. One is thinking about that increased stress level that they go through. It could be from their role as a caregiver. It could be from balancing caregiving responsibilities with other life priorities. So that stress that is often experienced over time can place them at a higher risk because it makes their body react in a way that usually it doesn't have to. It creates additional inflammation, and with inflammation, we see an increased risk for cardiovascular disease. But other than stress, we all know that with caregiving, you often have limited opportunity for you to engage in the desired lifestyle that you would like, right? So thinking about those lifestyle habits and the healthy living, sometimes with caregiving, your schedule is affected, and you may not have as many opportunities for you to engage in those heart healthy habits, and that places you at a higher risk. And there's a lot of research that have compared caregivers to non-caregivers over time to see how caregivers may be at a higher risk. And yes, we do see that often it's not only the cardiovascular disease diagnosis, but also these additional risk factors that caregivers often have. And I say this, and I don't want the listeners today to feel alarmed, because there's a lot that could be done and that we could do early on. Even though caregivers are at a higher risk, it doesn't mean that we can't do anything about it.
Okay. And Dr. Edmiston, is there anything you'd like to add to this?
Yeah, so I think it's important to understand that chronic stress, it increases your risk of high blood pressure, it increases your risk of strokes, it increases your risk of heart disease, and it increases your risk of abnormal heart rhythms too. There are kind of two different ways that you could kind of approach it and think about it. Directly, chronic stress has a physiological effect on the body, like Dr. Irani was alluding to with the inflammation. But if you think about it, the stress response is elicited in the body when exposed to a perceived threat, right? So it activates the fight or flight system, the adrenaline hormone. And, this day and age, our modern world with social media, with caregiving, all of that contains so much stress that it essentially hijacks the mechanism of the fight or flight. So this prolonged exposure to the stress hormones causes chronic mental illness, anxiety, depression. All of those have a direct role into heart disease. And, the behavioral effects also make a difference, like Dr. Irani was alluding to. So as caregivers, if you're stressed, you don't eat right. That leads to weight gain. You can, reach for that cigarette to try to mitigate some of that stroke. So the behavioral changes indirectly also increase your risk of stroke in general.
Okay. Thanks for sharing. I mean, many of the things you talk about with stress and fight or flight, those are things that we talk about almost every day here as well. So thanks for mirroring our language. So I know that caregivers, and we all know this, that caregivers can be both men and women, but the majority of caregivers that I work with here at Courage to Caregivers, and that maybe you all see, are women. So I was wondering whether you could touch briefly on, do things look different for women? What are different signs or symptoms in women who are experiencing cardiovascular disease? And let's start with you, Dr. Edmiston.
Yeah, so women do present differently with heart disease, and this is an extremely important thing that I talk to all my patients about. So heart disease is the #1 killer in women nationally, and it kills 6 times as many people as breast cancer. Women, for a fact, are underdiagnosed with heart disease. Even when they are presenting with a heart attack, they're found to receive half the treatment as compared to men, and they're more likely to die from heart attacks. These are statistics. So it is very important for women to be their own advocates. They do present differently. So the typical angina, the exertional chest pain that I was describing, women typically actually don't present with that. It can be anything: nausea and vomiting, shortness of breath. It can be chest pain, arm pain, neck pain. That's why the most important thing is to be your own advocate as a woman. The other thing that I just kind of want to mention too is that there is something called broken heart syndrome. A broken heart is not folklore. So it is actually it presents as a heart attack. The symptoms are the exact same. The EKG, the test changes can be the exact same. But it's not from a heart blockage like I was describing before. It's actually a stressful event can happen. So it can be a happy event. It can be a sad event. And essentially that hormone system, the adrenaline fight or flight hormone, it surges and it can essentially stun the heart, and it can mimic having a heart attack. So wow. Absolutely, women, caregivers, be your own advocate. If you think anything is wrong, go see a doctor.
Well, I've never heard of broken heart syndrome before. Is that something that primarily happens in women, or does that happen in both genders?
Yeah. It can happen in both genders, but predominantly women. The good news is that it is transient. So if it does happen, it usually does get better. But if it does happen, that does mean that it can happen again.
Okay. Dr. Irani, anything you'd like to add to this question?
Not really. Just to echo what Dr. Edmiston mentioned, whenever you notice a change in your health, don't be just looking for those traditional symptoms that you often read about, because your experience might be quite different. And so whenever you feel a change, just trust yourself and seek medical attention.
And be your own advocate, it sounds like here. Okay, well, we're kind of moving to that part of this discussion already. So say you've been diagnosed with heart disease. Let's talk about finding a specialist or a care provider. What does that look like? I'm sure that could be daunting for someone that's gotten, serious news. Any tips for folks to find someone? And maybe you could say a little bit about medication too, if you're willing. And please, Dr. Edmiston, take this one as well.
So, the medical system can be a difficult system to navigate these days. We are, unfortunately, there's a long wait time. So it can definitely be a daunting process. As far as finding a specialist, I think the most important thing is to find someone that you jive with, that you can build a relationship with. If you do not feel like they're listening to you, if you don't feel like they understand you, go see someone else. It is okay to get a second opinion. It's okay to doctor shop. Find someone that works for you. The other thing is with medication. So in general, I am not a big medication pusher. I actually find it very difficult to take medicines and to remember. But especially with cardiology, all of these medications that are prescribed, like cholesterol medicines, aspirin, all these medicines, they are actually shown to have benefit through extensive research and big medical trials. Every medication does have a side effect that you can read about that we will tell you. I would encourage you to not take the medicine just because of the potential for side effects. Side effects do not, they don't, they're not the same with everyone. So always, if a physician recommends a medication, I would think about it, especially when it comes to heart disease. And, I said that heart disease develops once there's that blockage. There's no magic Drano pill I can give you to unclog the pipe. So you just don't want it to develop in the first place. And that's where the medications, the cholesterol medicine really makes a difference.
Okay, thank you. Dr. Irani, anything you'd like to add to this topic about finding a provider, tips, tricks, medication?
Right. I feel like with caregivers, they're often often experts somewhat in terms of navigating the system and finding providers for their loved one. But when it comes to caring for your own health, you can feel a little puzzled initially. I completely agree. Finding a provider that you can trust, that you can feel that you're being heard when you're with them in the conversation. In a way, you can treat it as if you're interviewing somebody. So if you showed up for a visit and felt like there wasn't a good connection, you could certainly get a second opinion and see if you can find a better match for your style and how you're thinking about your health. And when it comes to side effects, I know many times when we're thinking about medication adherence, side effects is the number one cause for why people aren't taking their medications regularly. And so if you notice any potential side effects, have that conversation early on with your provider to find alternative treatments instead of you waiting and avoiding to take the medication altogether. It's good to be upfront about that and have open conversations about it.
I also just want to add one other thing that, we're talking about heart disease, medicine, and, seeing a specialist, but also addressing the mental health component is extremely important. It complements the physical health in general. So treating the mental health, if you have depression, anxiety, all of that is extremely important. Anxiety, depression, it's all a chronic disease, just like heart disease is,
Yeah, and that's going to be a different provider for folks. So, and you may have to also screen and interview therapists, guys. And I think caregivers are so polite when it comes, to themselves. I think they pull that mama bear for the people they're supporting. So I just advise all of you to pull out that mama bear aspect of yourself as you're advocating for yourself. It's okay to switch midstream, is what these two professionals are saying. It's okay to seek a second opinion. So please keep that in mind. Thank you both. This is a hard one for people, finding the right person. I wonder, and either of you can start here. I have this one kind of open. Can either of you share any case studies or personal stories of some patients you've worked with in their cardiovascular health journey? Of course, with no names, of course, but any either of you willing to share someone you've worked with and their journey?
Yeah, so I can go ahead. So one of my patients, she was cleaning her house and she started to get some neck pain. It shifted to her back, then her left arm. She started to feel nauseous. She got short of breath. Then she started vomiting. She was actually a nurse. And so with a little bit of belly pain, so she thought that this could have just been a flare for diverticulitis. So she did go to the emergency room. She did the right thing. And she was found to have a heart attack. Even she was a nurse and even didn't realize that she was having a heart attack. So this can happen to anyone. And, I think we're kind of doom and glooming, heart disease a little bit. But I always tell people having heart disease, you can live a normal life afterwards. So another one of my patients, he was taking care of his mother, had a lot of stress, and one of his coping mechanisms was running. And when he was running one time, he passed out. He was found to have a severe blockage, and it was fixed with a stent, and he ended up running a marathon for his mother after she passed away. So, you can live a normal life with heart disease. It is important to continue to live.
That's great. Thank you for focusing on that it isn't a death sentence necessarily. There's plenty of ways to grow and thrive after that diagnosis. Dr. Irani, anything you'd like to add here?
Yes, I can provide maybe a couple of examples from my experience as a researcher. So I'm no longer practicing as a health professional, but I do in my research work with family caregivers and patients with chronic illness. And so with the current project, for instance, the one that I'm doing now, we do have a comprehensive assessment of cardiovascular health. We assess blood pressure and cholesterol levels. And I know that each time we do that, we have to share the results with participants. And I noticed that many individuals were not aware of their risk level when it comes to blood pressure specifically. And what Dr. Edmiston was just saying, you could live with heart disease and not even know it. With blood pressure, it's even worse. You often do not have any symptoms when you have high blood pressure. And high blood pressure is seen as the silent killer because technically you wouldn't know that it exists until you get to a much later stage of cardiovascular disease, or you might have a heart attack. It hasn't happened with my research team, but I do have a collaborator that while conducting the blood pressure assessment, and that's a screening that could happen also in any other setting, not just in the research setting, the participant had very high blood pressure. And whenever that blood pressure is high, we have to go through a protocol and screen for other potential symptoms. Now, the symptoms were not traditional symptoms, but the person was experiencing some symptoms, and they ended up recommending that she goes to the emergency room, and that person was also having a heart attack. And it was just happening at the right place and at the right moment for her to seek that medical attention. But again, it goes back to the idea of even if your symptoms are not typical, whenever you feel a change, seek attention. Know your numbers and know your risk when it comes to blood pressure.
What do you mean by know your numbers?
Well, I mean, you have to know whether you're at risk or not for having a cardiovascular disease. And often when you have a high blood pressure, you can be at a greater risk for developing cardiovascular disease over time. So if you don't know what your baseline blood pressure is, you have no idea what your potential risk level could be. right? And again, because with high blood pressure, you're not presenting with specific signs and symptoms that would make you seek medical attention. It's good to have those checkups with your provider regularly, whether it's yearly or more often if needed, to be able to know your numbers.
Okay, thank you for clarifying.
After people have heart attacks, I usually say the same exact thing, and actually I give a handout that says, HDL, LDL, so your different cholesterol numbers, your blood pressure. And it sometimes, especially for people that are very into data and seeing numbers, you can make the change like the cholesterol medicine, and you can see how your cholesterol decreases. So not just something in the computer, but you can make a table seeing how each of the implementations have changed your blood pressure, your cholesterol, all of that. So it can also lead to a sense of gratification that, you're taking the medication for a reason.
Great. Yeah, good point. Okay, thanks for sharing those. Wow, really, really interesting. The person having a heart attack, like in your office, that's wow, pretty intense.
Yeah.
Let's just. I want this to be, we want these to be a preventative talk as well. And again, I think we've been really good at focusing on that, but I want to take it one more step to just really ask specifically, how does one have optimal heart health, and be a caregiver? What are some preventive measures we can take? And I'll start with Dr. Irani here.
Absolutely. I feel like the conversation we just had is a good transition to this question. So again, the number one step that you could take is really identifying your potential risk. So we talked about blood pressure, cholesterol, and even if that meant tracking those numbers on your own, like Dr. Edmiston mentioned, you could be measuring your blood pressure frequently at home. That's something that you can do. You could, so the other dimension that we look at with cardiovascular health is weight, right? You could be watching your weight and tracking that over time as well. So when we look at the expert recommendations, and when we look at, for instance, recommendations from the American Heart Association, they look at various dimensions for cardiovascular health or heart health. And it's really looking at your health over a 24-hour period, looking at your whole day. So what happens during the day? You could encounter a lot of stress. So managing stress is one way. You are eating, and you have to maintain that balanced, healthy diet. You would be recommended to engage in physical activity, regular physical activity. But also, in a 24-hour day, you're expected to get adequate amount of sleep. So sleep is also another thing. So I'm like trying to put out there the big topics, and we could maybe like delve into each one of them and provide some recommendations. I don't know if Dr. Edmiston, you have any like thoughts about this, or should we like maybe jump into specific recommendations for each one of these?
Yeah, I mean, I completely agree with you. You can't change your age, you can't change your sex, but you can change these risk factors. So, in general, for the diet and weight loss, obesity is linked to heart disease. So being at a healthy weight is important, and the diet is important. So Mediterranean diet is what's recommended by the American Heart Association. So the rough and dirty that I tell people is fresh fruits, fresh veggies, and the less feet of the animal, the better. So fish, turkey, and chicken have 0 to 2 feet. Those are good for you. Any animal with 4 feet is high in cholesterol. So it should be a special treat. I'm not saying that you can never eat steak again, but those splurges are important to do in moderation only. Exercise, recommend about 20 to 30 minutes of exercise 3 to 5 times a week. The goal is for you to get your heart rate up. So you want to have kind of the glazed donut look. You're breathless, but you can still carry a conversation. That should be the kind of maximum. And then obviously, as you don't start out running a mile, build up very, very slowly, about 10% each week. Sleep is extremely important, which Dr. Irani can probably speak to a little bit more, but I will just say that sleep apnea is a risk factor for heart disease. That's very underrated. So what sleep apnea is, you stop breathing in the middle of the night, sends off that hormone surge that we've been talking about, and to wake you up so you can start breathing again. And that's been linked to heart disease. It's a newer diagnosis within the past 10 years, but it's extremely impactful for cardiovascular health in general. So, if you have been diagnosed with sleep apnea, try to wear your CPAP as much as possible.
Dr. Irani, yeah, please.
So absolutely. So I guess maybe I'll start with the sleep, since this is where the conversation's going now. Absolutely, sleep apnea, but also sleep overall. So with sleep apnea, it reminded me of a lot of stories with our own research now, because we also do a sleep apnea risk assessment. And we find that almost half of the people in our sample are at a high risk for sleep apnea, and they don't even know it. So again, if you have any symptoms that could be related to sleep apnea, like whether you're feeling very tired during the day, if you know that you snore at night, if somebody told you about this, try to have those conversations with your provider, because these things could be related to sleep apnea. And again, getting that diagnosis and getting a treatment for it would be very helpful for cardiovascular health. So again, when I think about sleep, I'm not only talking about a disorder or disease, I'm also talking about sleep health more broadly, and how you could improve the quality of your sleep, but also the quantity of your sleep. So this is a recent addition to the cardiovascular health umbrella when it comes to, again, looking at data from the American Heart Association, including sleep as part of your cardiovascular health, because of the extensive research that has shown that people who sleep less than 7 or 6 hours a day are at a higher risk for cardiovascular disease. The same goes for also people who sleep for more than 9 hours a day. So I'm not recommending to just go and spend more time sleeping that is beyond the recommended time. So usually we do like to get anywhere between 7 to 9 hours of sleep each night. And some maybe recommendations for how to do that: having a regular routine scheduled for your sleep is very important. Just like you schedule anything else for yourself during the day, it would also apply to your sleep schedule. I often recommend people to set an alarm for a bedtime routine, just like you would set an alarm for you to get up in the morning, because you need time to just calm yourself down, get yourself into that sleep mode, and try to engage in activities that are more relaxing around bedtime, as opposed to activities that would introduce stress into your bedtime routine. Now, again, with caregivers, that can be challenging, because at the end of the day, you're trying to catch up with a lot of other things that you have to do, or even you still have caregiving responsibilities to take on in the evening. So you just have to be mindful of that, and know how to also adjust not only your personal routine when it comes to bedtime, but also the routine of other people that you're caring for, right? So if that means, if you would like to go to bed around 10 or 11 at night, maybe that means that you have to start getting everybody else ready to go to bed way before that, so that you are able to get enough time for yourself to catch up on your work and go to bed around that same time. So again, the regularity of at what time you're going to bed and at what time you're waking up is very important. And I think a misconception is when people would say, during the week, it's okay if I didn't sleep much, because then on the weekend, I can catch up on that sleep. And that's not how our bodies work. You need to be able to maintain that consistent bedtime routine each day, and be waking up almost at the same time, as opposed to trying to catch up on any sleep that is lost.
The only other things that I think that we didn't mention, diabetes is an important risk factor to control, and smoking. Smoking is another risk factor for heart disease. It is important whichever way that you can to stop smoking.
Thanks.
I also wanted to add, I know with diet, we did talk about the Mediterranean diet. I know one other thing that we often recommend is reducing your salt intake. And many times we don't think about salt as the added salt, but there's salt in a lot of other food that we eat, right? Like dairy products and even some vegetables have salt in it. And sometimes we don't pay attention to how much salt we're getting. Salt is important because it helps with your muscles and your nerves, but also salt can help build up more fluid in your body and can increase your blood pressure. So really thinking about the sources of salt in your diet and how to read nutrition labels. So when we're looking at a nutrition label, sometimes we get we're a little misled if we're not paying attention to the serving sizes on those labels. Right. So if we're looking for sodium, which is salt, and so overall, the recommendation is not to exceed 2,300 milligrams in a day for salt. It's better to even limit it to 1,500. And when you're reading those nutrition labels and you're looking at each product, sometimes, again, what's written on there in terms of sodium is per serving. If you're eating a bag of chips and it's a big bag and it has like 5 servings, you're not getting only that number that's listed. You have to multiply that by 5. So I just wanted us to be more careful with also how we're reading nutritious labels and being mindful of how much we're actually how much calories, but also like the other nutrients that come with the calories and how much we're taking of that.
Thank you. Dr. Irani, anything you want to add about physical activity? I'll remember that donut metaphor from Dr. Edmiston, but anything else you'd like to add regarding activity, physical activity?
I would say sometimes when we think about physical activity, we have a lot of ambitious goals for ourselves. Like even for myself, I think about physical activity as being this big thing. And sometimes you can have strengthening exercises that you can do throughout the day. It doesn't have to be like 45 minutes or 60 minutes in one stretch. You could build in also some muscle strengthening that is a little different from the recommendation when we think about like vigorous physical activity. But building your muscles could be also helpful. Just another way of thinking about physical activity or exercise, I should say.
That's great. Making things micro is something we talk about a lot for caregivers, is trying to, cut it into small chunks that make it achievable. Either of you have anything to add about, and I feel like we've talked about this a lot, but it's very important, about stress management and mental health as we're thinking about optimal heart health and caregiver status. Either of you, please.
Yeah, I mean, so absolutely. Taking care of your mental health is just as important. And actually, there are many mechanisms that have been shown to be effective with managing stress. So social support is extremely important. So, reach out. If a family member wants to help you, there is no shame in accepting that help. Meditation has been shown to have a benefit. And I know that Courage to Caregivers focuses on meditation, breathing exercises, cognitive behavioral therapy, animal therapy. Pets have been shown to have cardiovascular benefit. So little things like that may seem little, actually really together really do make a difference. And yoga. Yoga is the other thing that Dr. Irani was kind of alluding to, that not everything is running a marathon. Yoga is great exercise, and it has been shown to help with stress.
Dr. Irani, anything you'd like to add on that topic?
Not really.
Okay. Excellent. Thank you both for that. I mean, this is why we're here, to really focus on these preventative measures. Just really one final question, then I'll just open the floor to any questions from the audience or from either of you if there's anything else you'd like to add. What's the latest research in heart health, or how are providers supporting caregivers in their heart health journeys? Dr. Edmiston first, if you don't mind, and then Dr. Irani.
So I think I would be remiss if I did not mention the new medications like Ozempic, Mounjaro, the GLP-1 agonists that people have been using for weight loss. It's actually been around for a while. Back in 2016, those medications were studied to look at cardiovascular benefit in diabetes, because originally they were diabetes medications. And it was found to have cardiovascular benefit. It decreases your risk of heart attacks, decreases your risk of strokes. And there was that positive benefit that people were losing weight. So I believe it was 2021, they had another trial, and it showed that patients were losing up to 15% of their body weight with these medications. And most recently, they looked at these medications in people without diabetes, it was shown to have cardiovascular benefit. So, these new medications are the new hot medications. It can be difficult getting them right now because it's become popular with celebrities for the weight loss, but they are excellent medicines that I think that probably will revolutionize the cardiovascular arena.
That's great. Dr. Irani, anything to add on this?
Yeah. I guess I'll take a slightly different perspective to non-pharmacological approaches. And I heard Dr. Edmiston mention earlier meditation for improving your mental health, but there's also new research looking at mindfulness-based stress reduction intervention in terms of blood pressure management and blood pressure control. So a lot of the interventions that we often use for stress reduction could then be tailored and also used to reduce cardiovascular risk more broadly, and hopefully reduce the risk of cardiovascular disease on the long run, although there isn't a lot of research on that yet. But again, there is now evidence looking into mindfulness and meditation programs and how that could reduce blood pressure.
That's great. Okay. So we're coming to the end of my planned questions. I wonder if there's anything either of you would like to add or say in summary. I don't see any questions at this time from the audience. Someone is saying, Dr. Irani, you were one of the best professors they've ever worked with. So you have a fan out there. Very sweet. Would either of you like to say anything in closing?
Sure. At the end of the day, especially with caregivers, I always tell them to try to practice heart intelligence. This is how I like to put it. Essentially, try to understand, use, and manage your own emotions in positive ways to relieve stress, communicate effectively, and overcome the challenges that you're going through. You can't get rid of stress, unfortunately, in our world, but learning to manage it is the most important thing. So find what works for you. Courage to caregivers, reach out to them. It's a great thing that they have, great resource for you guys. And also the American Heart Association has also great resources for patients and really going through healthy living, what matters, even down to recipes for patients as well. So I would encourage you to go to the American Heart Association website.
Yeah, thank you. Dr. Irani, anything in closing? And I do see a question in the chat box, but I'd love to hear. I love the heart intelligence thing. That's a really great way to put it. Dr. Irani, anything in closing for you?
Yes, absolutely. Just like maybe a couple of tips. I know we talked a lot about lifestyle changes and engaging in all of these healthy behaviors, but then one might pause and say, how do I actually do that? How do I incorporate this into my life as a caregiver? I think coming up with very specific, achievable, and simple health goals. Don't make it too big. Start with baby steps. Sometimes I recommend people, whenever they're introducing a new health habit, to try and pair it with something that they've already been doing for quite a bit of time and it's established in their routine. So, for example, if in the evening I know that I have a specific time that I'm like doing the dishes, right after that, maybe I could go and do some stretching exercises or do some mindfulness. And so whenever I pair it with something that's already established in my routine, I'm more likely to then remember to do it. And then always find a system to keep you accountable. Social support, yes, that's great if that works for you. It may be more of an individual system to keep you accountable. Add it to your own calendar. Schedule your me time to engage in a specific health behavior, right? Like if you don't add it to your schedule and it's not a checklist, sometimes it can get mixed. Just like you are planning your caregiving activities on a day-to-day basis, have that be an item on your daily schedule.
Well, I don't know what happened to Dr. Edmiston. Hopefully she can come back. That's perfect. Thank you. Again, mirroring many of the things that we say. And so it's so validating to have someone as articulate and as accomplished as you are also saying these things. Potentially, I'm going to ask you this question. And if you can't answer it, that's okay. Since you're not actively practicing, but you are a professional. So since so many
I'll try.
Yeah. Oh, there she is. Great. Oh, hi. So, but this question's for both of you. Since so many of the tests that might indicate heart disease, like CT scans, ultrasounds, EKGs, make sure I understand this question. Is there anything that you can suggest to get a baseline on what's going on with your heart aside from outward symptoms already shared? So Dr. Irani or Dr. Edmiston or whoever would like to answer that.
I guess so. I would go back to my initial point about like, I don't know if they're trying to get at actual diagnosis and diagnosing a cardiovascular disease, but if it's more looking at risk factors, again, you could check your blood pressure, your cholesterol level, you could check your blood sugar level, track your weight. These are just the ways in which you can get an estimate of your cardiovascular risk factors that you can then intervene on to prevent cardiovascular disease.
Yeah, just to kind of piggyback off of that, I think getting a baseline EKG is fantastic. It is a very simple, very easy test that can be done in the office. So always getting an EKG would be important. As far as an ultrasound of the heart, really it's only when there's an indication for it, either testing, symptoms. It's not something that I would necessarily recommend as a baseline. I will just say that there is something called a coronary calcium score, which is beneficial for younger folks. And specifically, the reason that it's helpful is because it can kind of guide us to whether you should be on a cholesterol medication sooner rather than later. So if you're 40, if you've got a family history of heart disease, if your cholesterol isn't high enough to start a medication, but you see it's on the upward trend, or you have increased risk factors for heart disease. So what the coronary calcium score does is essentially it's a CAT scan, and it looks for calcium deposits on your coronary artery. And that tells me whether you have heart disease. And not only does it tell you whether you have heart disease, it could actually quantify it as mild, moderate to severe. Wow. So, it's beneficial in some people because, when they see that they don't have heart disease, they feel better. But if they do see that they have heart disease, they know that, we've got a high tail. We have to work on this.
Hmm.
The other thing I just want to mention is that the calcium deposits that I'm talking about are on the outside of the blood vessel. So you could have a very high coronary calcium score, which tells me that you got lots of calcium on the blood vessel, but it does not tell me what's going on the inside of the blood vessel. What's important to know about what's going on in the inside of the blood vessel are symptoms. So matter. If you have symptoms, go to your doctor. Because, oftentimes I tell people, you have heart disease. Okay, well, doctor, can you just go in there and fix it, put in a stent, and we could just be done with it? That putting in a stent actually does not prolong your life. It only helps with symptoms. So that's why we just keep harping, know the symptoms and be your own advocate.
Great. Thank you both. Okay. Well, we have shared some resources in the chat here on YouTube. I think unless either of you have anything else, I thank you so much for attending, and thanks to all of our registrants and viewers, and everyone have a wonderful evening and take care.
Thank you.
Thank you.
Okay.